So the theme of this roundtable has three different oppositions, which it's structured around, and Guy has actually asked at the end of his sentence, the three oppositions are the product as opposed to a solution. That seems better. And the second is global, which be opposed to local, and it could be understood as systemic as opposed to something which is isolated independent. Or the third opposition possible is something which would be standardized, or personalized. We will be talking about the different oppositions through the different point of views, very different points of views, from the manufacturer of health products, but also the service provider. The services are for patients directly, or if they apply to the health professionals, for example. And then finally, through the perspective of the buyer, who should be estimating a value to what has been proposed. In my humble opinion, and this is my last point, in my humble opinion, we are missing an actor in this roundtable. This was for the regulatory body representative, because often it's a regulation which actually is the framework for the healthcare, and they also provide indications concerning the value, and the signals are then used by the buyers and also the payers. We're going to start with you, Luc Delporte, to introduce the subject of this evolution from the sole product to an end-to-end solution. Where are we today from the point of view of this evolution and the point of view of the buyers in the hospital sector? So our procurement policy is part of the Unicancer framework, Professor Jean Blais, and also our Madame Sophie Vauper, our managing director, who supports professional health workers' research to facilitate access to healthcare and innovation. We can give as an example our last market, which is symbolic of our work, which is the market of digital solutions in the health area for the patient's pathway. And this is a market that we have defined through this logic of the pathway of patients, but it also mobilizes all the different actors involved in this area. You can have directors of health, you can have cancer specialists, you pharmacists, you can have the different health authorities, et cetera, et cetera. So in fact, so we have 170 different experts that were working on the definition of this for this project. And they were talking about this pathway, looking at different complementary solutions with 5 different themes: the patient pathway and different solutions for that, different digital applications for the patient, and the teleconsultations, remote consultation, the 3D modulation, and specific solutions for research. And this work was led with the support of all of the different IT persons responsible in the different healthcare facilities, so that they could be involved with the solution integration in the different IT programs in the centers. So the dimension of research is very important in this tender, and this is for this reason we R&D in Unicancer was involved in the choice of all of these different solutions for this market procurement process. So we addressed the Health Innovation Agency, which presented the project, and they relay this into their network. They communicate to their network, the different innovative companies like startups. We've also organized the different presentation meetings with the main different reference contact persons with startups, so that we could ensure that the definition of our needs and our investment corresponded to the reality of the market and to its evolution and perspectives. Thank you. So if I sum it up, solution means something which is more integrated with a lot of expertise, which comes from different actors. And I would like to know what does a manufacturer think? maybe if you don't do the same kinds of equipment, but what does the manufacturer think about this health measure? Yes, the integrated solution. We like to have more of this. In fact, the integrated health solutions are very good. If I look at the manufacturer's perspective, it's the same. It's a product. It's not isolated. It is interdependent within a medical act. It's within a different healthcare pathway integration that is important, and it's an important lever for the pathway, and it has different strong impacts in the clinical, organizational, economic impacts. Also, to have these benefits, it has to be within a adapted healthcare organization which can integrate these technological innovations. I would like to give an example, a simple one, to illustrate this. A different medical measure. You have for something a miniaturized heart implant, so you can go from that would be in the surgery and a specialist with hospitalization and with a lot of different consultations with patients. But this technology will enable to do outside the surgery, and it can be done outpatient by a trained nurse, because we have this artificial intelligence, so we can avoid the passage in the surgery thanks to this technology. So we can change fundamentally how we treat this person. Things are developing. Less than 50% are in the surgery for these implants and 50% by the nurses. So this illustrates the different obstacles we have to really set up this innovation. And it requires, we have to reconfigure the health pathway. We have to have this change model. We have to have different protocols, and we have to have the right funding. All this would be integrated in an organization which enables this technology. The technology alone would not be sufficient, because, in fact, we don't take into consideration this aspect in this approach, which is ecosystemic and also holistic. Now, going beyond the equipment, evolution also is affecting the different wards in hospital and also outpatient. Now, if we look at the different services for the patient, then we'll be looking for the different professional actors. What can you tell us about the different recent evolutions, for example, in the catering area, for example? Yes, first of all, to give you some context, the Sodexo Health compares the different catering for the staff and also for the visitors. We have special medical spaces for this. We have also, and we have the cleaning spaces. And recently, we have launched an activity which is called the Doctor House, which came from an innovation approach. And this provides services to health professionals so that they can free up their health. They have more free time thanks to this. So for this new activity, if I now precisely look at the catering business, what we see is that it's a service which will take place in a more complex context, which this context is connected to transformation of the medical activity, which will be impacting the catering services. Now, you're thinking of outpatient? Yes, we're thinking of these different protocols, DG0, which take into consideration specific profiles of patients and the different pathologies. And this, in fact, is a good evolution. We also have many different regulatory, we have the different laws, the LIM, for example. So the different healthcare facilities need to orientate themselves to conform with these laws, and in parallel. And it's not always with the regulatory angle. We see now for 2 years there is this acceleration of the corporate social responsibility for these departments. And all of this is within this different economic constraints and organizational constraints for these health facilities. So all of these evolutions really will orientate us towards this holistic services. because the different healthcare facilities are not, for example, looking especially for this catering service, but they want to have a complete holistic service so they can obtain and achieve their different objectives. It could be maybe economic performance. It can also be the challenge of transforming their catering model. And as I said, corporate social responsibility is also important. So with EurAsia, we are partners of EurAsia. We saw the evolution, the grouping of the EurAsia. We saw this evolution of the different services, the added value we can have, because we support these establishments for their pathway. So how can they actually meet this LIM law? And so if it's in sector private or public, we also have this low carbon activity in catering. So we were able to have a good reduction in carbon, low carbon, and reduction was very important so that we can really establish our roadmap for the reduction in our carbon footprint. So what you want to do is propose several different things outside of catering as we imagine it, with a different meal packages. You have other services, and also looking at the environmental aspects of low carbon. So these are the services that, in addition that you described. Yes, these are the different challenges to have. So how can our service of catering or other activities, we have other activities as well, how can this lever, how will it contribute to the different performance challenges and strategic challenges? You not completely, but you were talking and centering on patients. And we also are fortunate to have Jean-Urbain, who is focusing on patients, but also on the health professionals. So what does that mean to have this holistic solution, end-to-end solution for health professionals and for patients? Well, I saw the theme, the topic, and saw the end-to-end solution. It's a little bit esoteric. And now this morning, when I was hearing that there was in CHAM a garage repair worker, then things could be even more difficult. However, this is really, when we talk about this, we are well known for what we did at the beginning in the genesis of Doctolib, access to, because it was very difficult in that time to have access to healthcare. And so we have all these administrative tasks. We didn't have the highly performing, effective tool, and so we also had consultations was difficult. So it was difficult for patients to have appointments with doctors, etc., because there's this evolution, increase in different illnesses, but so difficulties to have access to the good information as well, and also to really have different hours of that are available to have appointments was difficult. So the success. All of us knows that actors for the appointments making, and most of us have already used Doctolib for health appointments. So we even went further, and this is what I want to talk about, which is the only product. So you're centered on appointments, but it's a little subject which had a lot of impact. We worked a lot on how can we do more to improve the healthcare professionals, and how can the patients be in better health. And so we said recently we develop other solutions. So what we've already done, we have digital secretaries, we had development for the patients. We have other solutions that people don't know as well. We have prevention solutions to help manage the continuation of programs, to help with the coordination and the cooperation for the different healthcare treatments. And also we are working on these innovative projects. So with the generalists, the practitioners, we work with hospitals, clinics, with the nursing homes. We work with MSP that you were talking about earlier. We started with the general practitioners, and we went to the paramedicals, dentists, and all the different doctors at different levels. And also for the patients, we looked at the different services orientated for the healthcare givers, and Doctolib is to make an appointment, but then also to receive one's documents and to exchange messages also with the healthcare workers, and also to receive preventive messages now. So we had one single product, which was a simple one, which was making appointments, but now we have all these additional services. When we were discussing this, the idea was saying, globally speaking, yes, you have the patient, but also health professional, but you have really gone up in a higher level. You have societal issues, access, inequality issues. So this solution, how can it really meet these larger problems that were really different than the original, which is from the creation of Doctolib? There, I can give you aging population. We're working a lot about solutions for the nursing homes, also to help families who actually will be placing their family in the nursing home. We help them, and also we help to make the context between the families and the different actors. And there's another subject that everyone's working on, and it's very difficult. We have 45 some patients that are connected, and we have also healthcare professionals. We have capacity, have messages that we can transmit in this health ecosystem. And the quality of life for the professionals, we work on that because burnout is an issue, and we will commercialize this consultation assistance so they don't have to work on their software when they have consultations. So we're going to work on simplifying that for them. So we'll give you the floor. You were very well launched. So we're going to continue. We're going to look at the cause of all these evolutions. We also want to look at the consequences for the organization. And also we look at the economic models. So people are anticipating a little bit. There'll be some oppositions that we spoke about to see globally. What does that mean? Does that mean that everyone has the same solution, and then we roll it out everywhere in the world and apply it to everyone? So this is so you can choose the color as long as it's black, etc. Now, will that be something like that we're going towards, or we'll find getting more in the area of personalization that we've spoken about? So we'll be wavering. So how did you handle this? How did you make these choices, which will lead to these consequences for these solutions that you set up, which are solutions that are more transversal? Well, it is a good subject. We already, the first thing we did, we're a French company. That's important. So we have mainly French, although we internationalize in Italy and Germany as well. The point you're mentioning is to develop technology at the base and to do that in the health area. It's difficult and it costs a lot of money. So what we did, we had a global approach. We developed one single technological solution for the countries where we work, and then we adapted to the local specificities. Because you have security issues, confidentiality, privacy, etc. We could not each time we were in a country. So the way we did it, we really had to really work in the different, adapted to the context. And so to have a global solution platform is what we did. And I can give you 2 examples of this. We work outside of France in Germany, Italy. I take the example of Italy. It's a health model which is very different than the French model. So you have the GPs, which is by capitation. They don't have the compensation for the act. It's not very favorable to multiply the consultations. Or then maybe it's good to not have consultations on a given day. So we developed a message system. So when there are subjects when you didn't have to have a consultation that was necessary, then we could exchange synchronously, and this really exploded. So this message system really worked well. And in France, when we wanted to apply this solution here, not for the same reasons, but we had a similar need because the doctors, the GPs, are solicited the whole day long on WhatsApp, SMS, texto, emails, and telephones, even all the way to the end of their day. And so they have it's hard for them to juggle their personal and professional life. You don't have any legal medical tracking, so the message message that we developed for them in Italy, we actually replicated in France, so we could also, so the doctors could have control about the different subjects where they had messages being exchanged. And this was developing so we have 12,000 users every day for this. So what I find very interesting, you have this need have this economic model. You see, because of the investments, you need to generalize. However, it enabled doing things in function of local specific situations. You spoke about Italy, but I think it's similar in other countries. And so this way, you can really you can adapt these tools. Another good example, Frank was talking about this, but Germany, where you have these medical centers, which are what we did for them in Germany. We actually developed solutions to help them, to help the doctors to work with their different assistants. We have this in cooperation and task management tools. In France, we saw, not for the same reasons, but there's also a need to have a collaboration between the different cabinet and the other actors. So we use the same solution in France that we got from what we did in Germany. So there's a need, and we spoke about this, to develop European champions in our technological sector in health. You have the GAFA that invests a lot. Amazon has bought a pharmacy online. We know Google also is developing these booking online in different countries. So this raises the question, the capacity in Europe to develop champions in this area. There are 4 subjects that we see is very important. First of all, is to support these champions that emerge, not necessarily financially, but we make it possible for them to develop. And what we said is to be dare and be agile. And to do this, we have to have a solid foundation, and we have to dare more so we can develop these champions. And we also have to have not too many constraints set up that are imposed. We have Amazon. So Amazon has an investment of some 70x million. So the different resources that are available that have been tried with success, you go now today we have a segmentation of needs and personalization. Also in the catering world, yes. When I discovered the theme of this roundtable, I thought the subject of this global solution is very interesting when we position ourselves from the patient's experience, because traditionally we could also see the hospital catering as a succession of steps that are often isolated, often done in silo. They are not managed by the same teams. You have the order taking, you have the production in the kitchen, you have logistics at the different floor levels, you have the meal service, and when the interface is between the different moments. So, for example, 8 hours remaining outside of the rooms on the trades. No, so is what the moderator is saying. But so we don't always have this fluid chain, which you can, and for example, you don't have one person doing all this, and this could negatively impact the patient's experience. So, in the different reflections we had, more and more, we try to integrate all of this environment around the meal. You have the fact that the meals have to be adapted to the patient, to their profile, to the pathology, but also how can this meal and how is it served? How is it explained? So what is the table art? Does the patient have a choice in their menu? That increases very significantly the satisfaction, 10 points extra once we give the patients a choice for their menu. Can the patients also, of course, you don't have any impact on the quality, so says the moderator. So what the preferences of the patient, if we give them the choice, and then the satisfaction in catering is increased by 10 points, as I was saying. So finally, all this integration of these services around the food offer, it enables us also to develop these holistic solutions, which really take better better into consideration the needs and desires of the patients. What I wanted to share is a concrete example, an offer that we developed for patients that have cancer. 6 to 8% have lost their appetite. 70% also have their taste changing. That's when they have the chemotherapy. Yes, it's after the therapy. And the difficulty is 1 or 2 days before, they don't know exactly what they want. If they have something they don't want to eat, then they won't eat, with all the different nutritional and secondary risks that would involve. So now we've invented, based on all these studies and also our observation in our establishment, we have an offer at the floors. We have a different maître d'hôtel with the tray, and when the patient, they will have a nutritionist will be there, and they will have a varied choice, salty, sugar, cold, hot meals in small proportions, also to try and whet their appetite. And we realize that this kind of an offer, which are very personalized, really improves considerably the satisfaction of the patients, and also the quality of the exchanges and the relationships between the patients and the healthcare givers. Now, can this go to all the way to the way that you won't have the sacrosanct time for meals, for breakfast, lunch, and dinner? You can have a certain amount of flexibility, but that, of course, is something that we're working on with the Exxon group by developing this offer, which gives more choice to the patients concerning the different times where they take the meals, and to have a broader access to a meal. This is a hotel signature activity. This is a Symphonia offer, as we call it. And here we see this progressive orientation for this kind of an offer. I did see something a few months ago which really gave me lots to dream about. I visited the public hospitals in New York, and they had a big transformation of their catering service. It's not to do a copy and pasting, but in the transformation, they created a team which was trained in nutrition, but also in the catering services in general. And these persons will be taking the order from the patient. They will serve the meal. They'll be there. They know the menu, and they will come back in the afternoon to get some feedback. And in this case, the catering team, they have this feedback concerning the recipes, satisfaction, and we see the satisfaction rate. Thanks to this transformation, we see that it really worked well. So the culture of evaluation and feedback is very American. So what I find very interesting is this opposition between the producer's objective, who could, so the logic of the producer, which could be standardization, which could involve the patient in this producer logic, and saying, finally, I get more satisfaction and I have a better feedback if I'm capable of asking their opinion. It's not their opinion in absolute. It's a choice amongst the different offers. But it's not more complicated, but I'm capable of handling that. I find that's very interesting that we have actors like yourself who are, they have the advantage of doing things that everyone said they could do. But however, there's people who do it well and others who don't do it well. People do it at the right time, others who don't do it, and they're always late. So you have reintroduced complexity and segmentation and personalization. I find that's really interesting. Now, what does the buyer think of this personalization? How far should we go in the personalization? And we're staying in the area of cancer with you, Luca. Well, the personalization and the global solutions is translated by the training and to respond to different research issues, which would we put in the different innovative practices in our healthcare facilities. I can give you some examples of what we set up in the different radiotherapy market and also the handle of risk management. We worked on ERSN. We have the radio protection training program of the patient. And in this framework, we've already trained 1,200 professionals in our establishments on this. Another example of the different the risk management is for the cybersecurity training that we co-design with professionals, and so that we could train our professionals for the protection of data. We also have training solutions that are very specific, so we can support the different departments that set up these advanced practices. For example, the CLB example, Léon Vera, who set up this organization, which is born on the different radiotherapy experts and the imagery reading. We worked on the specific programs for training in that area. We're also working on the theme of the radiation issues with different researchers, and this is for the context of the fight against cancer. We have a training day organized at the Centre Lombera, and this is in the line of the one we've already done at the Center of Reims, a partnership with the League Against Cancer. And these are concrete examples what we've set up in terms of training. And in terms of collaboration and research, and we also set up these research protocols in our different tenders, definition of our tenders to be specific. These are protocols that are specific to the new different radiation issues. These protocols, we work with the research group UNITRADE, anti-cancer group. So here we could set up in our specifications specific clauses which will enable the candidate applicants to respond to different research areas that we've already proposed. So in fact, that's what I find very interesting. So you have the personalization, a customization. I don't like customization too much, but however, it intervenes thanks to the innovation, thanks to research, so that you can make available for the patients these the most innovative techniques, and techniques really extreme, like irradiation issues, rescues programs. You, industrialists, where are you at? What are the definitions that you would give in a very summary fashion of these global solutions? Is it customization, standardization? Is it global or not? Listening to them, in fact, it's difficult to really say I'm there or on the other. There's not one single definition. There's not one. There are 3 definitions I've heard. They're all good and they're complementary. When I listen to you, a multifaceted approach. You have technology, research, information, IT. When I listen to you, I hear this notion of modularization, globalization. We work on the different scales of and when I look at globalization, does not mean standardization, protocolization, but not necessarily. It's always going in line with personalization. So I've heard these 3 complementary definitions. If I bounce back on that, because from my perspective as an industrialist, I would start saying we have technology. It is in a more global pathway for health. We have multi-components. However, when I look at the healthcare system, when I see this fragmentation, that all this definition of the healthcare models and the change models are left to local actors, establishment, medical teams, and they don't have the critical size to define the right healthcare model, especially if we ask them to do it on lots of different cases and lots of different medical uses, if we ask them to do that. So if I think of us as industrialists, and the advantage that we have is that we are present in some 100 different countries. We're present in these different establishments. Each one of us is focused, not many on the use case based on as compared to the health establishments. And we, in fact, have the critical size for these medical situations and these different usage cases. We can invest to see what are the best practices in all the different countries. And behind all of that, we can professionalize all of these change models. We have the right critical size for that. We have a time issue here. I would ask each one of you in 1 minute, recommendation and conclusion. Okay, we'll start here. Hind, in a nutshell, I have 3 recommendations. One for catering, and the first one is the importance of co-development. All the innovative solutions that really are highly performing, they were created in experimentation and co-construction with the health establishments, and that's something that that's very important. The second recommendation concerning the catering of the medical personnel in the different establishments, I am convinced that an important progress approach to improve the quality of the healthcare providers is very important. We're very active with this, with the different businesses. And what I can see, I think it's really something that we really could capitalize on even more in the health sector. We can make this tie between performance, commitment, and quality of our workplace. And also with Dr. House Challenge, this provides the different services for the healthcare professionals, and this is in the area of coordination, which should be promoted even more to free up medical time, and also to have better quality of a workplace. And for you, Jean-Urbain, we didn't speak much about artificial intelligence, but others have done that. The fact of integrating all the different solutions is a way of having a global product which is specialized or personalized and adapted. This is a subject that we've invested a lot on, and we're working a lot on. And the second one is collaboration between the different private actors. Sodexo Health, we work on MSP. Also, we work with public actors as well. We have this regulatory frameworks that are to be clear and established, so we can work with the public authorities to develop the best solution. And these are really principles that are important for us. Luca, the creation of the value of a product is, and a project is, if you can have in the early on period, is very important. So what I recommend is to situate ourselves at the beginning of an innovative project, and you have different tenders like 20, 30, and so you work with the scientific experts to really co-develop our needs today and in the future. In the cancer area, we have partners, we have different digital solutions that we're working on. We're also actors in works that are in the area of the European cancer plan with digitalization involved in health. So it also means internalization in your case. And for the end conclusion, I've heard the word collaboration. That's key between industrialists and healthcare workers. The second point, openness, being open to the world. We heard about this. There's lots of different healthcare models that exist everywhere. And so take what exists, take what's been proven, and start there. That's a starting point. And the last point is to ensure that we have evaluation frameworks and financing. So we talk a lot about experimentation, but I don't really think of really going up at a higher level. So maybe the last question for all of you, in a word, how can we do something about this fragmentation, which was done for efficacy? We specialize things, and now there is a need. In fact, with an author that I like a lot, to find robustness, because in a very stable environment, it's good to be very efficient. But once you have something that happens, then everybody is hanging on to the tree. What can you do about this as industrialists, as a service provider? How can you handle this? There's one answer, which is satisfaction. Satisfaction, the MPS, this is what is important for all. So this is the satisfaction is important. impact, multi-factors. We have to be able to understand this multifactorial aspect. Thank you very much.